Hi, Mr. Smith. I'm Lexi. I'm going to be your student nurse today. Can I verify your name and date of birth? Okay, great. And do you have any allergies? No allergies? Great. Did the doctor inform you that we're going to be doing a IV insertion for fluids? Yes? Okay. Well, we are going to be doing that with a 20 gauge catheter. And I am going to prep my meds and my fluids. Okay, so I'm going to pull up 3 mils. Pull back 3 mils. Okay. I'm going to recap and dispose this in the sharps. Now I'm going to set up my INT. I'm going to make sure it's unclamped and hook this up. I'm going to flush this just to make sure it's working properly. Alright, it's working good. I'm going to clamp that and put it to the side. Now I'm going to find a vein. I want to make sure that the vein is distal on the arm and on the most non-dominant hand. I'm going to avoid areas that are painful when palpitating. Do you feel any pain? No? Okay, good. We want to find a vein that's large enough and that's soft and bouncy. So right here would be good. And can I have you clench your hand in a fist? Okay, good. I want to choose a site that's not going to interfere with the client's ADLs or with procedures that might be coming up. Okay, so I'm going to find a radial pulse. Radial pulse is felt, and I'm going to tie the tourniquet 4 to 6 inches above the insertion site chosen. Okay, and then I need you to just put your arm up like that. Okay, now I'm going to wash my hands and apply clean gloves. Alright, clean gloves are on, and I'm going to clean the site. Okay, starting in the inside and working my way out. And I'm going to pull the site taut. I'm going to grab my catheter. And I'm going to make sure the bevel is up. I'm going to insert the catheter at 15 degrees. I'm observing flashback, and then I'm going to push the catheter in another 1/4 of an inch. I'm going to remove the needle, throw it in the sharps, and pull the tourniquet. Now I'm going to hook up my INT. I'm going to unclamp this, and I'm going to look for blood return. Blood return, and then I'm going to flush this and flush it a little bit, and then once I have positive pressure, I'm going to clamp. Okay, and then I'm going to apply the transdermal patch. And I'm going to initial the patch, date the patch, and remove this. And then I'm going to put the gauge size, and I'm going to tape this to where it won't be in the way. And I'm going to assess the patient's pain, make sure everything is okay. I'm going to assess the insertion site and make sure that there is no redness or inflammation. I'm going to clean up all of my things, make sure everything is disposed in the sharps. And after everything is cleaned up, I'm going to make sure the patient has the 4 Ps, and I'm going to document the time and date of insertion, the site, the size and type of the catheter, the number of attempts, the client's response to the treatment, and the instruction that I have given them.